Hello everyone, this is the series of videos that I promise you to share with you in detail step by step about the anchorasis phenomena or retrograde infection. So I have this lower left molar, which is number 7037 molar. So the case is really strange and you should be careful about these cases. Now the patient said that I have pain in this. Why they have a pain? Because they have swelling in this lower 8. Okay, and as she is from far away from our city, so she came, she extracts this tooth in the same day. We decide to finish the case and make a root canal therapy for this. And you see there is a little change for the case, but really the case is far from the pulp. So why they get infection? Because they get infection from this lower 8. So it is chronic pulpitis, the case. So this is the case I take every time as I see, and I remember you that you should document your case, please. So this is the lower 7, and you see the cotton as this is the cotton that they do extraction, our team, our great surgeon. So they put this sterile cotton with iode until I finish my case. So I directly put the rubber dam to prevent any contaminations. So this is the case, isolation, cleaning of the operative field, then removing the composite. Then you see it is very far from the pulp. So why they get infection? Because of the lower 8 that they give the bacteria inside or retrograde infection. So after I make a access opening, just perforation to the pulp, I see that here we have a vital pulp, because in the chronic pulpitis still we have some vital tissue inside. So I remove more roof and I finally finish the access opening, and here we have still some pulp tissue vital, so we see the bleeding. Okay, so for every case, what we do is to put the sodium hypochlorite at least for 10 seconds inside the pulp chamber to prevent any contamination. Because in the endo we have two scenarios. Either we have the case which is contaminated, the endodontist, they should never do contamination for the case that they didn't have a bacteria. So you have a case that they didn't have a bacteria, the endodontist, they prevent contamination. Or we have the case that they have already bacteria inside, so we decontaminate so we have these two scenarios in the endo. So here I put the sodium hypochlorite inside. Now I make a patency management for the case. You see the case is a tight canal, and we are using size 8 for the working length determination. And after that we are make a calibration. The length is about 21 and 22 mesial and distal canal. So I am using the reciprocating handpiece to manage the patency and glide path management, because the case is difficult. So I start with size 8, size 10, then size 15, then size 20, because I should be sure about the patency and glide path management. Then I will jump to the rotary files. So I start with the rotary file, which is 15 taper 3, then 20 taper 4, then 25 taper 4 for the mesial canals, then 25 taper 6 for the distal canals. Then I should make final disinfection for the canal, at least about 2 to 5 minutes according to the number of the canals. Then what we do is the case is ready for the obturation, and just put the sodium inside and make a gutta percha selection, starting with 25 taper 4 for the mesial canals. Then I see that it is a little bit over one of the canal. Then I use the 30 to be sure that the canal is exactly to the full working length with the positive tack back. Then 25 taper 6 for the distal canal. Then I check the distal canal again. Here again I should check also distal canal for the larger size. If the larger size is suitable for the canal or to the full working length, I choose the larger size based on the rule maximizing the aperture, minimizing the sealer. Then I make a dryness for the case. Then for the mesial canal, the dryness with the taper 4. Then I am using a bioceramic, which is the canal is ready. Then final obturation. Then I remove the mesial caries that I have already. So I finish the case, final restoration with the composite. And this is the preoperative, and this is the postoperative for the case. And here the site for the extraction, and this is the cotton that we remove then, and then we send the patient to the home. The important thing about this case is that we have a case that they have retrograde infection. I hope you get benefit from this video. Join and enjoy our videos. Stay healthy.